Hello, this is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. In this video, I would like to talk about the natural healing process that the regenerative medicine treatments that we utilize and what's involved in them. The normal healing process and cascade after an injury includes 3 defined steps. And the regenerative medicine treatment process utilizes those same healing processes. After an acute injury, what typically happens is the inflammatory process. What that means is that you have a surge of platelets and white blood cells into that area of injury, and you develop inflammation. During that inflammation process, the white blood cells clear out any infection that could be there, and they also secrete a number of cytokines or growth factors, and the platelets do a similar function as well. And during that inflammation process, what you'll develop is swelling, redness, more discomfort temporarily, and even warmth, and that can last from 3 to 7 days generally. Sometimes a little bit longer, but generally during that time course. After that, the additional cells that are drawn in from those white blood cells and platelets develops into what's called the proliferative phase. During that process, you develop the foundation for what is then the healing cascade. You have cells and growth factors and cytokines that help to lay down the foundation, what eventually becomes the healing steps that are next involved. That can take weeks to a couple months. It also then leads into the 3rd phase, which is called the remodeling stage, whereupon you have additional cells, including mesenchymal stem cells, fibroblasts, other vascular cells, that then help to rebuild and replenish that area of injury. Regenerative medicine works by utilizing cellular factors that help to escalate and progress that process in either a chronic injured area to help reinitiate that process, or in an acutely injured area to help accelerate it. For example, we utilize platelets and platelet growth factors to help reinvigorate that process. The growth factors from those platelets help to re-energize the mesenchymal stem cells that are in that localized area of damage. If we utilize your own stem cells from either your bone marrow or fat or other sources, we're trying to take the cells that are really involved in helping to initiate and control that healing cascade and process, and utilizing them in a very directed fashion by injecting them in an area that's been damaged. Regenerative medicine works by harnessing that natural, normal healing process to then push it into a stronger level, or to take a chronically injured area and to restart that natural process. Thank you for your time. I hope that gives some additional insight and understanding for why we're utilizing regenerative medicine treatments. Have a good day and live well. Bye-bye.